Afternoon. On behalf of Dean Cheryl Healton and all of us at NYU's College of Global Public Health, I'd like to welcome you today to our Global Women's Health Forum. The topic is the politics of global women's health, women's rights and health in the 21st century. And we have an amazing panel of speakers today, so I'm glad that you all had the opportunity to join us. My name is Dr. Tara Shirazian. I serve as the Director of Global Women's Health for the College of Global Public Health. I'm also a practicing OBGYN here at NYU Langone, and I'm the president and co-founder of Saving Mothers, a global nonprofit whose main goal is to decrease maternal death in pregnancy and childbirth. So this afternoon, we have this fantastic panel for you today. We're going to talk about women's issues and women's rights. As we all know, with broad-scale efforts afoot to restrict the rights of women domestically and globally, our panelists will help us understand the issues facing women and what can be done by the public and private sectors to safeguard the health and safety of women and girls, LGBTQ youth, and adults. So there's a lot to talk about today. Please join me in welcoming our speakers. First, we have Elizabeth Cafferty, U.S. Liaison, UN Women. Elizabeth is UN Women's U.S. Liaison, managing advocacy, outreach, and partnership building with the U.S. government and Washington, D.C. She was previously the UN World Humanitarian Summit's gender advisor, overseeing the agreement of a groundbreaking package of commitments to women and girls in humanitarian settings. Prior to joining the UN, she managed an international research study on sex trafficking of women and girls, as well as global reproductive health care initiatives at Mass General Hospital. Elizabeth also spent 8 years working in London on international women's rights and refugee issues. Next, we have the Honorable Doris Lynn Cohen, New York State Supreme Court Appellate Term Judge. Welcome back to Judge Lynn Cohen. She is NYU Law Class of 1979, where she was honored with the 2016 Women of Color Collective Award. In 2002, Doris Lynn Cohen became the first woman of Asian descent to be elected to the Supreme Court in New York State. She is the founder of the Asian American Bar Association of New York and the New York Asian Women's Center, which provides support and legal assistance for victims of domestic violence and other forms of abuse, which we'll talk about later today. She wrote one of the first marriage equality decisions in the nation in 2005, Hernandez versus Robles. She ruled in favor of same-sex marriage, very controversial at the time. This later was reversed by the New York Court of Appeals. Recently, she was named one of the nation's outstanding women lawyers by the National Law Journal. Next, we have the Honorable Carolyn B. Maloney. Congresswoman Carolyn Maloney's career has been a series of firsts. She is the first woman to represent New York's 12th Congressional District and was the first woman to chair the Joint Economic Committee. Only 18 women in history have chaired congressional committees. A champion for domestic and international issues, Maloney helped pass legislation that targets sex trafficking, provides annual mammograms for women on Medicare, and funding for law enforcement to process DNA rape kits. Her legislation to create women's health offices in 5 federal agencies was part of the landmark healthcare reform signed by President Obama. Maloney has fought to restore the United States contribution to UNFPA under President Bush and succeeded in increasing funding for UNFPA in the Foreign Operations Appropriations Bill. Internationally, she supports a comprehensive approach to end obstetric fistula. She sponsored the Obstetric Fistula Prevention, Treatment, Hope, and Dignity Restoration Act, which focuses on efforts to build local capacity and improve national systems to prevent and treat obstetric fistula. Representative Maloney has authored and passed more than 70 measures, either as standalone bills or as language incorporated into larger bills, many of which sought to improve women's health and rights. Next, we have Latanya Mapp-Frett, Executive Director, Planned Parenthood Global, Vice President, Planned Parenthood Federation of America. Latanya Mapp-Frett is Executive Director of Planned Parenthood Global, the international arm of Planned Parenthood Federation of America. As such, she helped set the course of Planned Parenthood's international engagement, including participating in the United Nations and U.S. government advocacy. The Federation's international arm works to ensure that women, men, and young people in some of the world's most neglected areas have access to the health they need to control their bodies and their futures. Ms. Frett previously worked for 8 years as a human rights officer for the United Nations Children's Fund, UNICEF, and for 10 years with the United States Agency for International Development, USAID. She has received many honors and awards, including 2 esteemed meritorious honor awards from the U.S. government and the highest honor in civil service, the Supreme Honor Award from the U.S. State Department. Last but not least, we have Monica Simpson, Executive Director, Sister Song, Women of Color Reproductive Justice Collective. Monica Ray Simpson has organized extensively against human rights abuse, the prison industry, racism, and systemic violence against Southern Black women and LGBTQ people. Sister Song's reproductive justice framework says that every individual has the human right to decide if and when they will have a child and the conditions, decide if and when they will not have a child and their options, parent the children they already have with the necessary social support in safe environments free from violence. She trained Black youth in activism, philanthropy, and fundraising as the Ujamaa Coordinator for Grassroots Leadership. She's the only woman among the 4 founders of Charlotte, North Carolina's Black Gay Pride Celebration, one of the first in the South. She has been featured in many publications for her activism and has written many articles on LGBTQ issues, over policing of Black communities, philanthropy, and Southern activism. Please join me in welcoming our esteemed panel today. Okay, so first I'd like to begin with a question for Congresswoman Maloney. Congresswoman, you have been a champion for women's rights in the U.S. Congress and have been vocal in your opposition to backdoor efforts to restrict funding for screenings, treatment, and family planning. What do you see as the biggest threat to women's health domestically?
Well, there's so many attacks, I don't know where to begin. And I'd say that my staff just told me there are going to be 2 markups of bills repealing the Affordable Care Act. Mm-hmm. But one of the provisions in the Affordable Care Act is critically important for women. There are a number of provisions in it. But it says that men and women have to be treated equally in insurance. Those of our sisters and brothers who fought for the Equal Rights Amendment tell me that what really killed the Equal Rights Amendment back in the 1970s, when they did not get enough states to ratify it, was the insurance companies, because they wanted the freedom to charge women more for their health care. So in the Affordable Care Act, it equalizes it. You cannot charge men less than women for their health care. Also, insurance companies treated the birth of a child as a pre-existing condition. So I had many expectant mothers who came to see me, and they could not get insurance because they were pregnant and had a pre-existing condition. How fair is that for a country that says that they value families and want to support families? But you see how key the Affordable Care Act is to other equalities for women. If that provision is removed, which was considered the barrier for the Equal Rights Amendment, then it should be much easier now to pass the Equal Rights Amendment if we can hold on to the Affordable Care Act. The 5 agencies that I passed a bill to have them have women's health offices, that was in the Affordable Care Act. It even has provisions in it for breastfeeding, to have a quiet place that you can breastfeed or pump milk. But the largest assault against women's rights to control their own health care has been against choice, chipping away at a woman's right to choose over and over again. And I say on the floor many, many times that there is no choice if you don't have access to choice. So they've moved beyond and are attacking access to choice and access to contraception. There have been a number of proposals to cut off women's access to contraception and to choice. Their most notable one, after the Hyde Amendment, one of the first bills, we know that the Hyde Amendment says that federal funding will not be there for abortions, but it's always been reenacted every Congress. But this time they made it permanent. That was the first vote. But then they came forward with a bill they call Joint Resolution 43. And what it is was a backdoor attempt to literally restrict a woman's constitutional right to an abortion. Mm-hmm. And in a very sneaky way. They don't say, they used to go to the floor and let's just, cut off access to abortion, let's just overturn Roe v. Wade, and they'd be killed in a vote on the floor of the Congress, and killed in the press. So now they come forward with the most confusing subject where people can't really determine what they're doing, and then they claim they're not doing it. But what they're doing is a backdoor attempt that you can, under any circumstances, would really end a woman's right to choose because it would cut off access. And it says that no not-for-profit, such as Planned Parenthood, but there are many not-for-profits that are out in communities, very dependent on federal funding, what we call Title X, that you would not have any monies for your regular screenings and services and health care if you provided abortion. So therefore, there'd be tremendous pressure on a Planned Parenthood or any other organization because it's so hard to raise private funds and to get private funds. You're dependent on Title X and federal funding. They would then cut off abortion in order to get the money for the other services. Now, Planned Parenthood has publicly said they would never, under any way, cut off funding for that. They would continue, but they're a very, very strong organization. Most young women in our country get their health care from Planned Parenthood. And we've heard testimonies in Congress from health professionals that if there was no Planned Parenthood, there would be no one else to provide those services. I have 2 Planned Parenthood offices in my district, and when I go at the end of the day, like at 5 o'clock after work, literally young women are lined up out the door and around the block waiting to come in to get services. Yet, to me, when they first proposed to cut off funding for Planned Parenthood, I almost could not believe it because it's such a vital health care provider. Yet it has passed the House of Representatives. It has never passed the Senate. But we are at the most weakened point we've ever been because we do not have the presidency, we do not have the Senate, we do not have the House, and we do not have the Supreme Court. So no matter what their shenanigans were, I always knew that President Obama had a lot of ink in his veto pen, and if it by any chance got to his desk, it would be vetoed. So you don't have that protection now, and that is why I think the Women's March was so incredibly important. The energy of people rolling into the streets. That day I flew back from the inauguration to speak and be part of the march in my own district, and we were expecting 10,000 people. The police are telling us that over 750,000 people in New York alone turned out for that march. So we have to figure out how to grab that energy and turn it into positive action for women's health and women's services. Probably the most famous statement I've ever given in Congress, I even walk in a room and people say, "Where are the women?" was in a Planned Parenthood hearing where they were trying to roll back access to contraception and federal plans, and they had a whole male panel that was making this decision on women's health. And I said, where are the women? Where are the women? You're making a decision on their health care. And they had the audacity to say to me that the women witnesses that we put forward were not qualified to testify before Congress. I would say any woman is more qualified to testify on their health and the health care of other women than any man, as much as I respect men. But it was just an outrageous time and statement. So I think the assaults on a woman's right to choose are real. The appointee to the Supreme Court is against Roe v. Wade. He even wrote the very famous Hobby Lobby decision that gave more weight to employers to make decisions on contraception and healthcare choices than women. So this is an extreme time. I remember when I announced for Congress back in 1992, not only was it because the Republicans had cut funding to the city of New York by 79%, and who should vote for a Republican who votes against the rights and the economic benefits of your city. But it was the day that they rolled back one of the pillars of Roe in the so-called Casey decision. So that it's been a constant attempt almost every single day, every single week, ways of chipping away at access. And if you have no access, you have no right to choose. You have no Roe v. Wade.
Thank you. Thank you so much, Congresswoman, for that response and for really helping us understand what goes on the level of Congress every day and the fight that you have every day to hear women's issues heard. And I know I, for one, really thank you for all the wonderful hard work that you do each day for the community of women domestically and globally. The March on Women was a very powerful movement, not only domestically but globally, and I think it really underscored the reason for this panel. We really cannot be complacent in what we know are our rights and our health. We really need to fight for our rights every day and to remember that they're constantly in jeopardy, if not by this administration, by another, but we need to constantly be talking about it and having our voices heard. So thank you, Congresswoman. I'm going to go on with the questions, but we're going to take lots of questions from the audience as well. The next one is for Elizabeth Cafferty. As U.S. Liaison for UN Women, what do you see as the single greatest threat to women's rights, either domestically and globally? So this first question is sort of the same question, but posed to each speaker a little bit differently. Thank you.
Thank you, Tara. I would say from the UN perspective, the global perspective, that we've felt, I think that if you're working on these issues every day, for the past few years, it's felt that there's been a backlash, that we've seen, as Congresswoman Maloney said, chipping away at this agenda for many years. And I think now there's bigger global momentum, which is the really scary thing, and that people are being much more overt in their challenge to women's rights and the misogyny that we see every day. And this is essentially a women's rights issue. Women have right to the highest attainable standard of health. They have the right to access comprehensive sexual and reproductive health care. There's no way to talk about women's rights to political participation, economic empowerment, freedom from violence against women, which are all the priorities of UN Women as the agency mandated to lead on gender equality and women's empowerment in the UN, without discussing women's rights to health. What I've seen a lot of in the past few years, again, this sort of chipping away. So as you heard, I have background in humanitarian affairs. Well, we were working on what the agreement we were going to come to on women and girls' rights at the World Humanitarian Summit. This was the area which was the most challenging to discuss and reach agreements on. This was the area where member states, international organizations that have, even have very strong favorable policies, behind closed doors would question things or would say, do you really want to use that language? Oh, we're okay with it, but I don't know if other people are going to be okay with it. So I think there has been, I think that lots of people who aren't in this, aren't steeped in this every day in the past few years, 5 to 10 years, have seen this public discourse of, girl power and women's empowerment and heard lots on like a post-feminist world. And if you took that at face value, you really wouldn't have realized what was going on and that this agenda was never a secure one, was one that everyone on this panel in their work, in their personal lives, had to actually fight for every single day and had to defend every single day. So in terms of the situation we are in now, I would say it's not entirely surprising to those of us who've been working on this for a long time that this has always been more, or this has become more fragile than any of us would wish that it would be. I think having said that, there have been a number of governments that you've heard recently make very strong statements and also put their money where their mouth is in terms of this issue. The government of Sweden, which of course has a feminist foreign policy with Foreign Minister Margot Wallström, who I was with last week in Geneva, she has committed, the Swedish government has committed more money to support local NGOs, international NGOs on the ground in countries that are delivering the sorts of services that Planned Parenthood delivers. The Netherlands has also stepped up to join that coalition, as have a number of other governments. Obviously, the Canadian government is very strongly speaking out about this issue. So we are in a challenging environment, but again, we do have momentum, I think, or I think this has woken people up a little bit and is creating momentum, both at sort of the grassroots level, and there were marches around the world. So obviously there was the march in DC, the march here, but there was solidarity throughout the world in terms of marches. And you also have governments stepping up, you have other international organizations stepping up. So I think it's a first step, and I think there's more work to be done, but I think maybe because of where we've come to, that there is a greater commitment amongst a greater number of people to try to turn things around.
Thank you for that, Elizabeth. And I think the name of the name of the Dutch Minister of Foreign Trade, Lilian Ploumen, she now has amassed $190 million as of the latest report that I saw just the other day from the Netherlands, Denmark, and Belgium to support organizations that have been threatened by the global Gag Rule, which we'll discuss in a few more minutes, yeah. So that's wonderful, and it's great to know that there is that momentum globally on the part of other countries and other governments. It's exciting to hear. Okay, next question is for Judge Lynn Cohen. As New York State's first Asian American elected to the Supreme Court, you have been hailed as a hero in the LGBTQ community for your 2005 ruling upholding same-sex marriage. 6 years before the state legalized same-sex marriage and 10 years before the U.S. Supreme Court deemed it constitutional. Could you please speak to the current administration's efforts to roll back this progress, protections for LGBTQ youth already in place? Can you help us to better understand as a group what risks to health and rights these reversals in public schools would mean for these already vulnerable youth?
Thank you. It's a pleasure to be here. I wanted to put in historical perspective LGBTQ rights. As indicated, when I issued my decision in 2005, I was the first in New York State to decide that there was such a thing called marriage equality, and the third in the country. And then 10 years later, the United States Supreme Court agreed with me. So we have to look at this long perspective, this historical perspective, and that things can be accomplished no matter how you feel about your odds. And so what has happened recent times, in 2016, we had a historic guideline issued under the Obama administration by the United States Department of Education and Justice, which really provided very comprehensive guidelines to all the state schools, public schools, about how to treat transgendered kids. And it covered, the focus now has been, it has to do with bathrooms. It's not just bathrooms, it's how to address the kid, the pronouns, the names, the use of bathrooms, the use of other school facilities, etc. It was very comprehensive, 8 pages in tiny print, and that was very controversial. And recently, in February, under this current administration, that guideline was essentially recalled. And so there is no specific guidance to states on how to treat transgendered kids. However, there is, and some people argue, an overriding federal law, Title IX, which says you cannot discriminate on the basis of sex if you, school, receive public funding. So that has been used in many states to advocate on behalf of transgendered kids. And there was a pending case in the United States Supreme Court, which today, apparently, they've punted back to the Fourth Circuit. But that leaves open the protection still of transgendered kids under Title IX. And even with the rollback, I'm trying to give you kind of some good news, all right? Even with a rollback, and so we don't lose hope, the guideline that was issued recently says, note that this withdrawal of these guidance documents does not leave students without protections from discrimination, bullying, or harassment. All schools must ensure that all students, including LGBT students, are able to learn and thrive in a safe environment. So even under this guideline, there is some room to advocate. I would also add that the State Attorney General in New York State has issued a reminder that under New York State law, that there are protections, and so that is also a tool that can be used by transgendered students in New York State. And so that is not to say that the powerful tool of having a Department of Education and Justice guideline that was issued previously was not more powerful. But one should not lose sight that there are still avenues to protect transgendered kids. And it's very important to their health, because in 2016, data showed that 42.8% of LGBT youth respondents had seriously considered suicide in the previous year, and 29.4% had attempted suicide. So it's an at-risk population. You add the whole issue of gender identity on top of that. And so clearly there are some health consequences that are at stake here. And it's, if you look at the various communities mobilizing, I will say the LGBTQ community is definitely mobilized. As I understand, there's a hotline you can call. There's a phone call, a mass phone call that people can actually call tonight to get involved.
Thank you so much. Thank you so much. I think it's so important today that we really talk about this vulnerable population of youth and adults and understand how the current laws affect, this particularly at-risk group. And thank you for all the great work that you and Monica, and I'm sure many of our other panelists do for them. Okay, so next question, LaTanya. As Executive Director of Planned Parenthood Global, can you speak to what consequences you are seeing on ground and what's happening in affected countries and organizations currently? What do you see as the best way to respond to some of the attacks that we are seeing globally, such as the Gag Rule? And if you want to first define the Gag Rule for us, and then tell us how countries are coping with it, how Planned Parenthood is coping with it, and what's being done to address it.
Absolutely. Thank you so much, Tara. And thanks to all of you for coming out and chatting with us. Again, Planned Parenthood Global is the international branch of the Planned Parenthood Federation of America. And so I have the privilege and opportunity to look outwards and work with more than 100 national organizations across Africa and Latin America. And these are the most amazing organizations that are champions in their countries for reproductive health services and reproductive rights. And it gives me great pleasure to support them both technically and financially through our donors here in the United States so that we can further their work, but also allow them to protect their young people and allow them to ensure that their women have access and services every day. So it is disheartening when you ask about how is it impacting them, the global gag rule, which I'll define in a couple of minutes. But because they are such incredible organizations, and right now they are afraid. They're afraid because I think sometimes we take for granted in our country that every dollar that is spent on women's health really is a dollar to save her life. But it also means then an opportunity for her to be able to access a much broader life. It means that she will have access if she can now determine her own rights, if she can determine how many children that she wants to have, if she has access to contraception, if she can determine if she wants children at all. It means now that she can stay in school. It means that her children can stay in school. It means that her community, her village, and her country can develop. And so there's a whole line of possibilities that when people hear that not only are their funding is going to get cut, but it also means a very real development for their countries. And so it's not just these organizations, but their countries and their governments as well are actually not afraid. They don't know what's going to happen. And so when in the first day, I guess, of the new administration, the global gag rule was signed, some of us knew it was coming, but I think it hit our partners in developing countries a little harder, just because they don't understand. We have now for a decade been very clear about our intention as a government to support the work in reproductive health. Our movement has grown over these last years, and especially this last administration, with the support of Congresswoman Maloney and so many other organizations around the world, including the UN, to ensure that services are being provided. So the demand is up. Women are asking, they're learning, and they want to get contraception. They don't want to have to get in a position to have to decide on abortion. They want to learn how to be able to control their own bodies and space children. So now what the global gag rule says is that any organization who receives U.S. government funding through our foreign assistance programs will not be able to receive that funding if they refer, if they counsel, or if they actually provide abortion services, safe abortion services, even if those abortion services are legal in that country. And so it does mean that more than 60 organizations, international organizations, not including the United Nations, which UNFPA has a particular problem with this executive order, it means that they won't be able to receive funding. Now, I actually worked for USAID for some years under the Bush administration, so I know the disastrous impact that this will have on many organizations that just naturally are going to talk to a woman about her choices, what this means now that they have to sign on to. So it is a bit disheartening to know that now they're going to have to make a choice. Either I receive funding to be able to do family planning, and this is the worst part. This particular executive order has gone further. In previous years, it was just if you were a family planning organization that you had to worry about this. In this particular executive order under the Trump administration, it actually states that if you receive any global health funding, so that means people who are out there fighting for, let's just say, tuberculosis, also have to sign on and say, I'll never mention, I'll never refer, or I'll never counsel around abortion services. If you receive HIV/AIDS, which is a huge portfolio in our country, one that we're very proud of, the support that we've given developing countries around the world in HIV/AIDS, they too now are having to understand what this global gag rule means. So there's a huge amount. You went from $600 million, which is what the U.S. government provides in foreign assistance for family planning, to roughly now about $8 billion of U.S. government health foreign assistance that now can be affected under this rule. So it is disheartening. But one thing we tell our partners around the world, the same that we would say here in the U.S., is that Planned Parenthood is going to continue to be there. We're going to continue to fight. We're not going to stand back as these things happen. We're going to make sure, to the extent that we have the power to do that with the people in the United States, is to show that this is not something we support in this administration, and we're going to fight back. And as everyone else has said, I think the power of the people is with us. We're looking at, just this week, some implementation guidelines that have gone out. And we know that we're going to continue to fight that this will particularly affect governments that are trying to have commodities for family planning, because it means that in countries where their actual commodities, so their pills and their depot shots and their IUDs are actually purchased through this foreign assistance, are looking at a scenario where they won't be able to purchase this. So in very far off villages where women are coming back every 3 months for a depot shot, there is this possibility now that they'll come back and won't be able to get a shot. And that's what we're trying to avoid, and that's what we need to fight against. Not just Planned Parenthood, but all of us in here need to make sure that our government understands that that's unacceptable, that women who have contraception should get it at every point. And and whether or not their providers refer, counsel around abortion should not matter, especially if abortion is legal and safe in their country, because that's what we want for everybody everywhere. And so I think I'll just kind of lay out where I think we, as the people of this country who want to do more and who want to make sure that we don't actually reverse some of the gains that we've had over the last decade in this area, we have to make sure that we're supporting organizations like UNFPA, and so we don't just close our ears when we hear that we've zeroed out, and I know Congresswoman Maloney knows so much about this, but when we zero out the UNFPA account at the UN, that is a big issue for women around the world. And what that actually means for women. It's not just a bureaucracy somewhere that just won't get another dollar. It means that's another dollar for contraception that women won't get around the world. And so I want us to think broadly when we hear these things, and let this administration know that we're asleep no more and that we're fighting back when we need to. So thank you.
Thank you. Thank you so much for that, LaTanya. I think I read a recent statistic that even prior to this administration, there were 122 million women in the world who wanted access to contraception but did not have access, could not get contraception.
Married women.
Married women, okay, there we go.
Women. Yeah, that's
married
very
women.
Important, yeah.
And we talked about it actually in my class the other day. So the number of women that voluntarily would use contraception if they had that option is tremendous. And now, this was even before all of this. The statistic is prior to this administration. So it's a huge number of people, vulnerable women out there, who still would use it. The other really important thing I think, is that family planning is one of the most important ways that we can reduce maternal mortality worldwide. And this is something we talk about in class as well, that with family planning, birth spacing, and not being pregnant more than you want to be, you really can effectively decrease the rate of maternal death that women face around the globe. And we see that as we work globally. We see that in the field. Every day we work with women. And I agree, there's a lot more women who want access now that we've been starting to provide that access. So this is going to be a very challenging issue. Sorry, last point on that. As a physician, it's very challenging in the field not to refer women for services. It's actually part of a physician's Hippocratic oath to refer women for services when needed. And it's really an ethical violation, I think, for many practicing physicians in the field. Yeah. So it's been a huge issue for many people. Okay, last question for this question, Monica. So I pulled a statistic just recently, but I'm going to ask you about a few different things. That Black women in New York City died 12 times as often in pregnancy, labor, or from complications of labor between 2006 and 2010. Black women are also 40% more likely to die of breast cancer than white women. So in your work at Sister Song, can you talk about the work you do to address racial health disparities and what you see as the current biggest health risk to the community that you serve?
Yeah, so it is an honor to be able to speak with y'all today and to be on this panel of such amazing folks. I'm learning so much, even in the midst of being able to share. So for us at Sister Song, we've been doing this work now for 20 years this year. And we were founded, by this collective vision of women of color, realizing that our power together collectively was greater than our individual power. And what has been so, just astonishing to me as we've been forced to kind of step into this new time with this new administration is, whenever that night came and we got those results, I wasn't thinking about my work plan or what I needed to do the next day that I got to work. I was actually thinking about the women in Mississippi who have access to only one abortion clinic in their state. I was thinking about the women in Indiana that may deal with the same thing that Purvi Patel dealt with when she was looking to end her pregnancy. I was thinking about the folks in small rural towns who are just trying to make ends meet. Like, these are the folks that are going to be the most impacted, with what is happening in this administration, and my heart just sank, right? And, when thinking about the statistics that you gave specifically around maternal mortality, Black women are dying unnecessarily, right? And what's really astonishing to us at Sister Song, we actually started to do this work around Black maternal health around 2014, where we took a deeper dive around this, and we wanted to get to the root issues. For us, we're not a service providing organization, we're an advocacy organization, so we're looking at amplifying and really unearthing those roots that get to the deeper issues as to why these disparities are happening. And so we work with the Center for Reproductive Rights to do a report that we actually took to Geneva before the Committee on the Elimination of Racial Discrimination, where we wanted to get to the very core issues as to why maternal mortality was on the rise. And so we did these focus groups in the state of Georgia and Mississippi, where maternal mortality is at its highest. And we brought Black women together to talk about their prenatal care, postnatal care. We asked them about what access to comprehensive sex education or any form of sex education that they got. And overwhelmingly what we got from these stories, which I think is what helped to make our report so dynamic, was that at every turn there were a couple of things that it didn't matter how much education the woman had, it didn't matter what her income level was, the fact that racial discrimination was still very much a very real part of their experience when coming in contact with the medical industrial complex was unbelievable to us. When hearing how just walking into the doctor being stereotyped, walking into the doctor not getting access to the information that you need to be able to make those decisions, overwhelmingly hearing how the impact of having abstinence-only based education is really, really limiting people on their ability to understand their bodies and their ability to make their decisions was just mind-blowing to us. And so this report we were able to identify, again, it's called Reproductive Injustice, looking at racial and gender discrimination in the U.S. healthcare system, really helped us to really amplify the fact that we as a country we have to address what racism is in this country and how it impacts every facet of our lives, every single facet of our lives, and the medical system isn't void of that. What's interesting for me too when thinking about, the work that we're doing in particular, not only around Black maternal health, but how we are seeing like one of the largest threats right now is this issue of criminalization. And we don't think about how that is directly connected to healthcare and to reproductive health. We have the case of Purvi Patel, who was a woman seeking to end her pregnancy and was criminalized for that. The same thing happened to Kenlesia Jones in Albany, Georgia, right? We're also not talking about the fact that when thinking about the system of criminalization, pregnant women, like in the state of Tennessee, being criminalized for substance abuse, as opposed to there being some way to produce like opportunities for care, right? And for folks to be able to have healthy pregnancies and to deliver their babies and to be able to have their families. And so, when we think about like this intersection between reproductive justice and criminal justice, it's such a huge threat to us right now, especially under this current administration that is extremely scary, right, for our communities. So when that is for us like one of the biggest pieces of work that is so important. And what's interesting enough too, and when thinking about this criminalization piece, one of the ways that we started to get more deeply connected to this work was a couple of years ago around the story of Marissa Alexander, right? So this was a Black mother who was trying to protect herself and her family and was criminalized for that. And it wasn't until the story of Trayvon Martin surfaced that we were able to actually resurface her story, because she was already behind bars, a Black mother in Jacksonville, Florida, right? So this issue of criminalization we cannot ignore when thinking about what is at stake and what we have to prepare ourselves for with this current administration, because there is going to be every effort not only to roll back Roe v. Wade and our ability to have a choice, but if we're not talking about the ways in which women, mothers, pregnant folks, trans folks are going to become even more criminalized because of this administration, I think that we're missing a piece. And the last thing I'll just want to highlight, because I want to get to questions from the audience, is in this notion of choice. And this reproductive justice movement was created by women of color and named by Black women because we understood what it meant to have an intersectional movement, right? So when I went to the Women's March and I'm hearing all of these things about like intersectionality, I'm like, yep. It's exactly what we need, because we cannot do this work from a single issue lens. It doesn't work, and that's not, reproductive justice has always adopted and have been moving forward an intersectional framework. But when we get to this conversation of choice, which I think is an important, very, very important framework for us to continue to uplift. But if we talk about choice and communities of color, power and privilege and all of that play a huge role in choice. And so for communities of color, which is why reproductive justice really tries to talk about the fullness of our lives and the need for an intersectional analysis, is because people of color very rarely have an opportunity to exercise a choice, right? So we can have and we can do all that we can to make sure that like Roe v. Wade continues to stay where Roe v. Wade is, so that people will have an opportunity to walk in and to get the services they need or to have an abortion. But if you think about a woman of color, let's say she's a Black woman driving in the South to go get the abortion, and let's say that the person that's driving her is her male partner, and he's a Black man. They get pulled over, right? Because he's now stereotyped, because he's a Black man driving, right? And who knows what happens in that situation, because we've seen what happened to Sandra Bland, we've seen what happened to Philandro Castile, we've seen what happened to so many different people, right? So yes, you can exercise a right, but if we don't talk about the systematic barriers that actually will make it difficult for folks to be able to exercise and to actually get that right and that choice, then we're still missing the boat in the conversation. So our work is to really address those structural and very systematic barriers that are making it impossible for folks to be able to exercise and to live their best lives.
Thank you, that was amazing. Can see, yes. I love the activist work. You know, it's amazing, out in the community with the women, with the people, yes, and lobbying for them. And you actually made me think of something. Someone told me recently, a colleague said, the most important thing we can do right now is push really wonderful activist women into office, yeah, into public office, mm-hmm, to get these voices heard, mm-hmm, to get in the communities that you serve, to get, you know, women of color heard, yeah, in, you know, just kind of pushing them into political office so that, sure, so their voices can be even more highlighted. But so important. Thank you so much, Monica. Sure. So I have a few other questions, because I always have more questions. And I think I've been thinking about this question a lot, because it's been actually, I was thinking about it even before it was sort of out there in conversation recently, but I've been thinking about the word feminism and what feminism means, okay? Because, you know, I feel very much that feminism kind of gets a bad rap and has for many, many years. And so the actual definition in Webster's Dictionary of Feminism is a theory of the political, economic, and social equality of the sexes, and organized activity on behalf of women's rights and interests. That's the exact definition. You know, it doesn't say anything about, you know, you hear all these things in the press, well, feminism means, you know, alienating men and, you know, and all these other, I think, things are stigma around the term. So my question, which I think is a little bit of a difficult question, but I know you guys can answer it. What are the implications of modern day feminism? Is feminism effective as a modern day movement? And how do we make it effective as a modern day movement? Shouldn't we want it to be sort of this modern day women's movement? And we see here such strong, fantastic women on the panel today, so it makes me think all the more about what is modern day feminism?
To inform our answer, can
yes,
we take a poll,
sure,
of the audience? How
yes,
many of us consider ourselves feminists?
Okay, maybe it has a better rap in this audience.
This is actually surprising. Maybe not because, well, let me say, about 15 years ago, I spoke at the Harvard-Radcliffe Women's Leadership Conference. I asked the same question, and the audience size was 3 times this size. You know how many people put their hand up? Remember, Harvard Women Leadership Conference, 2. 2 people, not counting me, okay? That was 3. So we've come a long way just by asking that question and having people say they're feminists.
I think it's because of Beyonce.
Well, more power to her.
Just kidding. But to speak to that though,
Yeah,
I think it's
please.
I mean, I'm not in the beehive, y'all. I'm not trying to give Beyonce all of that. But what I will say is that I feel like what has given feminism this boost, right, and this kind of rebirth, is that young folks are taking this very, it was very, you know, academic kind of term and way of like doing work, and they have made it their own, right? They have made it intersectional. They have made it something that, you know, that they can champion for themselves. And so I just have to credit young folks, because I can't say I'm young no more because I'm like over that 35. You know, on the thing it says like 35 and like you're over that, whatever. Anyway, so I really just, I have to really credit, you know, young folks for doing that. And I think that, you know, popular education, pop culture has really aided in that. I can't take it away from the fact that, you know, Beyonce put feminists on the VMAs and, you know, Chimamanda Adichie was on a song, you know, dropping this definition of feminism, right? And like, and Beyonce's a multi-platinum recording artist. There's so many folks who are listening to this. That has an impact. And so I think that we've seen now, especially like with the Women's March and so much of, you know, the line is, or the veil is getting thinner between like our artists and like celebrities and like activism. Like we're seeing this art activist life come to be, and I think that that's impacting the way that, you know, the surge of feminism is actually, you know, coming about now. I got to give it to him on that.
And I think overseas as well, so I'm sure my colleague will, you know, I think we've maybe skipped a generation that remembers remember sort of the politics around it. And I think people in many of the countries that I'm in Africa and Latin America, are actually feeling it, you know? And so this generation, and you know, I have a 17-year-old and a 12-year-old, and they're both, you know, boy and girl, committed feminists, you know? And I think that it's no longer just political. It is about an expression of yourself, and I love to see it when I'm overseas, because they don't remember, you know, so white women were feminists and black women were not. They don't know all that stuff. They just know that this is who I am, and this is a characteristic that I respond to, and I love seeing that.
Excellent. So maybe we can harness that energy to continue to.
And I would say it's been the success of women. I can remember when I was a young student, my role models were teachers and nurses and librarians. I thought that was the only careers open to me, and I became a teacher. And then through taking the next step, it ended up in Congress. But when I talk to my male colleagues, they say, when I was 10, I knew I wanted to go to Congress and I wanted to be president, and they had all these big goals. And I think with the success, I can remember when Madeleine Albright was being considered for Secretary of State, and I'd be in meetings and everybody was laughing. Oh, of course they won't make a woman as Secretary of State. Well, she did become Secretary of State, and the second woman to become Secretary of State was probably more important, because then, of course, women can be Secretary of State. So it's I define feminism as women and men that are helping other women. Why wouldn't you want to do that? Which is basically what it is, trying to advance it. And even though we talk about the challenges that we have, we've made extraordinary advances in my lifetime. I can remember when harassment was part of the job, when there was no Title VI, equality of treatment in employment, or Title IX, equality of treatment in education, when there were advertisements, jobs for men, jobs for women, when back alley abortions were a way of life. So this is and death, I should say. So there have been massive advancements for women. Even in my own lifetime, when I went to Congress, there were 48 women members of Congress in '92. Now there's 103. So it's gone from a very small percentage to roughly 17%. Still greatly underrepresented, but we've made massive advancements. And even when you can talk about challenges, I think it's better to be a woman and a man, or whomever you are, in America than any other place in the world. So there are more opportunities for women and just massive achievements for women. I want to share that I'm putting a bill in this week on a women's museum on the mall. I was walking around the mall. They have museums for stamps, for space, for law and order, for every ethnic group, but not half the population. So back in 1998, I said, I'm going to put in a bill, we're going to put a women's museum on the mall. It took me 15 years to pass a commission that would study whether or not you should have a museum on the mall. And how can you empower women if you don't even recognize them? And I'd say that a lot of our history is like quicksand, you know, that it happens and then it falls away. And we need a centralized area where we can chronicle the achievements of women in academia, in sciences, in all areas. I use the example of Paul Revere's ride. Everybody knows it. But Sarah Ludington, at 16, rode farther, longer, through the night, through dangerous territory, to warn her father that the British were coming. But too often our lives are not noticed. And I did my own study with my interns of the 216 statues in the Capitol, only 6 are of women. Of the 2,500 historical monuments or designated places, only 5% are women. And if you look at a textbook, try to find something that mentions women. It's almost non-existent. And now President Obama made a focus of women in the arts and women in STEM, science, technology, mathematics. What better way than to have a area where you could go and study this? When I started working on it, I just thought, well, women aren't on the mall. But I can't find a museum anywhere in the United States or the world which chronicles the significant contributions of women in all areas of life. And I think it's long overdue. I've gotten 19. 19 was the constitutional amendment that gave us the vote. So I mentioned that to you to encourage senators and members of Congress to pass it so that we can have women's history also told. My daughter said she didn't like history because it was just a bunch of men and wars. And, but women have a very significant history as individuals, and I'd say causes, education, immunization, all types of causes.
So as an addendum, so after I asked how many of you thought you were feminists, then I said, who believes in equal rights for women? Who believes in equal opportunity? And everybody raised their hand. And I said, guess what? You're a feminist. So I'm encouraged by your response because I think that having that mindset and questioning is very important. And so I wanted to share a story from my own past, which was I helped start the New York Asian Women's Center, and that was the first organization on the East Coast to provide domestic violence services to the Asian population. And this was about 30 years ago. And it was very difficult for people who were victims of domestic violence to get services because of culture, because of language. And so just a group of women got together to talk about the problem. And we had a hotline within a few months. We had safe apartments, safe homes, and then we got funding. And then now it's 35 years later. They have two houses. They provide lots and lots of services. So you're able to do this grassroots by identifying a problem, getting people who are like-minded, who are concerned about the problem and trying to solve the problem. A lot of our issues are going to have to be resolved grassroots because lots of things are happening. There'll be we want to talk about the Violence Against Women's Act. The good news is that that's not, at this point, going to be repealed. That provided protections to undocumented women who face domestic violence. But the problem is that there's a plan for the defunding of all the programs, like 35 programs, that provide the funding to organizations like the New York Asian Women's Center, now called Womankind, who would provide those services. So, the problems are there. They are solvable by us, especially because you folks are here, because you folks are concerned. And I think that, I feel the energy in this room, even though it's kind of late. For me, I had a whole day of appellate arguments, so for me it's very late. But I do feel the energy in this. I'm encouraged. I'm encouraged by your participation, and I see great things from this crowd.
Let me just say real quick that if you want to solve problems like Doris so eloquently said, run for office, because that's what you do all day. You get to decide on a budget. You get to decide. You get to decide who gets to be a judge. You get to be able to support someone like Doris to move forward, which I was able to do. Yes. But anyway, consider running. It's very easy. All you have to do is go out and get about 1,500 signatures. You're on the ballot for Congress. And think about getting out there and running and really being part of the answers.
Yes, don't wait for someone to say, oh, okay, it's your turn. Because nobody will necessarily say that. If somebody I ran for office, I ran for judge. And if somebody had said to me 10 years before I ran, and say, oh, you're going to run for, I said, no, what, me? No, I'm very shy. So you never know. If I can do it, you can do it.
Look at the fools who do. Even become president.
How do I follow that one? I mean, the feminism question, it sort of drives me nuts because I think actually if you'd taken that survey a year ago and not everyone would have raised their hands, and maybe all of you would have, but I think a year ago we had people going, and I think that all feminism means is exactly what, I can't remember who said it now, equality between men and women. But patriarchy is an incredibly strong and real phenomenon. And if it wasn't, we wouldn't be in the situation we are now. So you do always have mostly men, but also still women, chipping away and say, oh, but actually feminists, they hate men. Oh, feminists are, pro-abortion, like they have abortion parties and, these crazy things to try to, that's the impression that some people like to give, right? To sort of divide and conquer women and make you feel like it's safer to align yourself with patriarchal institutions. You might get further that way than it is to challenge them. So I do think that that saying everyone is now a feminist, I think maybe today, maybe in this room, but we know that demographically that's not how people really identify. I mean, having said that, I do think, obviously, that we have so much to thank feminism for. And I think that we've heard lots of examples of women, and we were, hearing about a woman who I frankly didn't hear that story about this woman young woman alerting her father about the British. But there have always been
thousands of these stories.
There are thousands of these stories. But without sort of the feminist movement of the 20th century, there was not a collective movement. There was not a community really pushing these issues. The American Journal of Political Science did published a fascinating research the other year. It was a couple of academics who looked at all the countries in the world and their violence against women legislation. And it was a longitudinal study. So it looked at what happened between 1975 and 2005. I think it came out in January 2014 or 2015. And those countries that had the strongest legislation in place, they wanted to figure out what was sort of the single most important factor. Was it the number of women in the legislature? Was it the political ideology of the women in the legislature? What was it? And what they concluded was it was the existence of a strong feminist movement in that country. So a grassroots feminist movement made the biggest difference or as to whether or not you had robust violence against women legislation in your country. So I think that, you've already heard like these incredibly strong statements, and we've heard what the NGOs and the local groups on this panel are doing. So it's groups like that that aren't afraid to identify as feminist, as pursuing women's rights, that make the sort of greatest amount of change. Obviously, if we didn't have justices and congressional representatives also fighting for us, and the ones, Sister Song, I'm sure, goes, this is what we need your help with, Congresswoman Maloney, and then she goes and does it, and then she creates the sort of lobby in Congress and pushes for that legislation. But she also she needs, and I think it's sometimes, like as someone at the UN, I love it when I get lobbied, because then I can turn around and say, this is what they want, this is what I'm hearing. I have to sort of represent these women, which I'm sure you do all the time too. So it's actually very helpful for us to, and may actually lead in nicely to something else, to make sure that, you're having your voices heard and you're coming forward and telling us what you want done, because it helps us pursue our own agenda. And I think, sometimes it's challenging because things do get done behind closed doors, and so you're not always there. But I think that when you have, people like us on the panel, dare I say, you can be a little bit more confident, which is why we need more women. We need more women, because if there aren't women at the table, these things aren't getting done. And it does matter who those women are. It matters what, so just because you have a woman there doesn't necessarily mean she is pursuing the agenda that we've all talked about. I'm very lucky. I work for the UN agency that is the lead, as I said, on gender equality and women and girls empowerment. So I do feel like I'm in this luxury position of getting to, sometimes it is fight, but advocate for these issues every day. And that is also with governments who are not necessarily at this exact moment in time aligned with our ways of thinking. But we work with them all, and we're constantly explaining to them all, why it will benefit them, their countries, their governments, their GDP. We put it in whatever terms are necessary, that it's not necessarily the right thing to do that will persuade people, but the business case often makes a bigger impact with some governments. So we constantly are working to show them what the benefits are to ensuring girls can go to school, women have the right to health care, women are able to engage in decent work and employment. And so it's a long battle, and I think, being feminist means being optimistic, being energetic, and really being in it for the long haul.
Thank you. Thank you so much. So it's settled then. Everyone's going to run for office, and there's going to be a modern day feminist movement, and I think you guys are just the group to lead it. Okay, so I think I'm already overdue for questions, so we want to hear from you. This is your opportunity to ask all of those questions that you've been eager to know. And if not, I will ask more questions, so, I would speak up. Jen? She's bringing the mic around.
Hi, thank you so much for speaking on such an important issue. One thing I've noticed when kind of advocating for women's rights is, especially if you don't know where the other person's coming from, there might be kind of a lack of mutual understanding of certain terms, and perhaps using more like moral or ethical, logical explanations for X, Y, or Z kind of falls flat for a lot of people, but economic arguments showing numbers seems to be effective. And I don't know if anyone can just speak on their experience in that situation, maybe when numbers speak louder than lives, which is sadly the reality that we're in.
Well, it just reminds me, I was just in Senegal in Dakar, and in one of the organizations that we have been talking to, it's similar to what we might call a bar association here, but they do pro bono work for people who are marginalized, and particularly a lot of them are women, of course, who don't have access to lawyers. The group actually calls itself what we would consider an anti-choice group or pro-life group. They don't, quote unquote, believe in abortion. But the interesting thing is, the reason that they want to work with us, work with Planned Parenthood Global, is because they're seeing that a number of women are actually being arrested for what is either called abortion, illegal abortion, or infanticide. But they're finding from the providers that there's actually such a thin line, and some of these are clear cases of miscarriage, but for sort of what the level of justice that takes place. And so this is what we might want to call an untraditional partnership. But their concern is that these women are being arrested unfairly, being taken away from their families. They already have children at home for something that really is not a legal construct. It's been built on something that's fake and it's ideological and it makes no sense. And so, this group actually, despite what they believe, is very much committed to making sure that people, and especially women, are not unfairly targeted and put in jail because they don't have access to lawyers who can defend them based on the law. And so I think about what you're talking about. I think there's lots of us out there. Planned Parenthood has done so many polls and surveys that have seen that even people who don't support a particular ideological, let's just say, abortion, also don't want you to restrict it from someone else who does believe in it or who does need that choice. And so I think a lot of us up here are going to be able to tell you stories like that, because it is so true that you don't have to be aligned with me to see injustice and to stand up for injustice. And I think that's what Monica so well put about intersectionality. Your issue is my issue. I don't have to care about immigration rights, but I do know that it's wrong, and I'll stand up with you, and you stand up with me.
I'd say that you're absolutely correct that equality is really economics, and numbers don't lie. And if you look at the two major achievements for women now, I would say it's Title IX and Title VII, equality of opportunity, employment, that's economic opportunity, equality in education. If you can't get an education, equality in sports, how many sports that teaches leadership and you get all kinds of advantages with scholarships. But the number that is always put out there is the inequality in pay for the same job. And when I started work, it was 50 cents to the dollar. It's now 79 cents to the dollar. I got a raise, but it's still very unfair. And we did a report in the Joint Economic Committee, what does this mean over a lifetime? And it contributes to women being the largest segment living in poverty in America, because the lack of pay translates into your pension, your Social Security, your 401k, and it just compounds so that women end up with less money. I truly believe that I am getting too old and too tired not to take care of this problem. We have to get the Equal Rights Amendment into the Constitution. It is the most important thing to do for women's rights, for their economic opportunity, for their protection, you name it. It's critically, critically important. And since I was a teenager, I've been reading about equal pay for equal work legislation. None of it works. The only way it will work is to pass the Equal Rights Amendment so it is the law of this land, so it is enforceable in court. If it's not enforceable in court, then you can't win. And that is the tool that will allow us to do it. Now, I will tell you, and you mentioned the hierarchy that we have, it's a male hierarchy. Well, no one gives up power easily. And I was thinking, coming to this conference, when I went to Congress 20 years ago, I had 10 goals. I have accomplished all of them that appear very difficult, except for the Equal Rights Amendment. That then shows you that that is the most difficult. I went to Congress, I said, I'm going to build a 2nd Avenue subway. Well, it's now running. Everybody was laughing at me for 10 years. It'll never happen. And so a whole series of things. But it shows how hard that is. Another critical case was the Brancala case in roughly the late 70s. No, it wasn't the late 70s. It was in the late 90s, I think. But anyway, this was a very famous rape case where violence against women is one of our prime concerns. And this woman named Christy Brancala went to school. The first day, she's raped by 2 football stars. And people saw it. So it wasn't a case of he said, she said, where they think, who knows what the truth is. One of them confessed, yes, we did it. So Christy appeals to the school for help. They do nothing. She appeals to the city council for help. They do nothing. She appeals to the state of Virginia. She was at VMI at the time. They do nothing. And under the Violence Against Women Act, that was one of the first bills that I worked on when I went to Congress, she appealed to the Supreme Court. And it wasn't a case of a question. Of course, the boys got they probably got a raise and a scholarship. They did nothing to them. But Christy was humiliated, finally dropped out of school, and when I finally tracked her out, she was working as a bartender in a bar. She gave up her career, so humiliated. She appeals to the Supreme Court, and they say that she does not have standing. It's unconstitutional to use that appeal under the Violence Against Women Act to go to the Supreme Court. Well, if you put women in the Constitution, you have standing to sue. I mean, this is a big deal. This is a very big deal. She would have had her standing to sue, and she would have won because the guy confessed. He confessed. So this is a very important thing. And I'm very encouraged because of the energy that I felt at the Women's March, where so many women came together to protest. I never thought I'd see a woman taken seriously and almost get elected president of the United States of America. We've made tremendous gains, but we still have not gained equality for women in the Constitution. We have some of the most brilliant women legislators from the first beginning of Seneca Falls, and if you read their old works, they said, get the right to vote and use that vote, and you use the power of that vote to bring change. And one of them wrote, if you don't pass the Equal Rights Amendment, we'll be back here 150 years later and still not have equality. Now, Scalia wrote that if, and he was a strict constitutionalist, he wrote that if a discrimination case came to him in the Supreme Court, of course he would decide against women because we're not protected in the Constitution. We are half the population. We have tremendous power, particularly with like-minded men who are our allies. If we would score this and not vote for anyone who wouldn't support the Equal Rights Amendment, it polls at 100%. You ask any American, should men and women have equal rights? They say, of course, yet we can't pass it. And it's because of a fundamental, huge economic change. I mentioned the insurance rates. In our country, I was dumbfounded why the gay rights movement is far more successful than the women's movement. So I've gone to many scholars like Doris and others, so why is that? Why is that? And one explanation that was given to me is that it's not as large a population as women. We're half the population. And if we could make this happen, it would be a huge game shift in America in terms of opportunity, pay, scholarships, you name it, of equality of treatment. So it's important to vote for yourself and for other women, and I'd say for your country, because when women succeed, America succeeds. And I personally think we should try to take this energy of the Women's March and turn it into a movement to pass the Equal Rights Amendment.
Thank you. You actually took one of my later questions about what we can do as a call to action, and I think that's definitely one of them. You know, I think being able to mobilize, again, maybe as a modern day feminist movement, I'm just throwing that out there, but that's intersectional, that includes everyone, to do something like pass the Equal Rights Amendment. I mean, that would be a huge accomplishment. Besides voting in people who support it, Congressman Maloney, is there anything else that we could do as the public and concerned citizens to support this, to support you?
Well, I'd say that raise awareness. Raise awareness. If you're aware of an injustice, let's publicize it. Let's get it out there so that people are aware of it. most members of Congress respond to the people who elected them. That's why they get elected. So if you go to a member of Congress and ask them to support it, and I'll tell you exactly, there are 2 people in New York City that don't support it. So you should take your class and say, hey, let's get them to support it. And I'm going to tell you exactly how to do it. One is Peter King. The other is Donovan from Staten Island. Peter King is out in Nassau. And you go to them and you say, will you go on the Equal Rights Amendment? And they'll say, well, I support it. If it gets to the floor, I'll vote for it. And you should say, well, if it gets to the floor and you don't vote for it, the people you represent aren't going to vote for you. Now, I love legislation because it pins people down. If you go to any congressperson's office, they'll say, of course I'm for the environment, I'm for this bill, or I'm for this, I'm for that. But then you say, oh, will you go on this specific bill? Oh, well, I've got writer's cramp. I can't move my hand. They've got to, I'll vote for it on the floor. I'm totally for it, but I got to think about it. Well, then go back the next day. How many of you are in her class? How many of you are students? How many of you are students? Okay, why don't you do something? Why don't you do something instead of just studying it? As a class assignment, go out and see Donovan and go out and see King and try to find someone from their district that you walk in. You'd be surprised. You can get in to see them. Now, if they won't see you, get their public schedule and just show up and have the Equal Rights Amendment. And why aren't you on it? Over 100 members of Congress are already on it. Why aren't you on it? Write them a letter. Write them a letter. Write a letter to the editor. They'll print it. Why is my congressman not on it? We have a free press, thank God. Let's use it. If you write a letter to the press, you can say, I tried to see Congressman Donovan. He wouldn't tell me where he stood. Maybe the paper can find out where he is. Where's Waldo on it? Try to use your own creativity to get 2 people from one of the most pro-women states in America and the pro-women city. I think women have more opportunity in New York City than any place in the world because we are a meritocracy and we work and give people, if they can do a good job, we love them. We love immigrants. We love everybody. If you have a cure, if you can help Planned Parenthood, whatever it is you can do, we love you. So you go out and call up your congressman and get them on the bill. And I will come back in a month and give you an update on where we are on Intro 19, which is the Women's Museum. Why can't we have a women's museum? It doesn't even cost any money. We just want the opportunity to build our own museum along with stamps, textiles, space, you name it. It's time that women have their rightful place to tell the contributions. But if you understand, if you have a museum that talks about what women have done for this country, then it builds the case, really, for the Equal Rights Amendment and for more empowerment for women. How in the world can we become empowered and get stronger if we can't even be recognized? Look, think about it. And that's what a museum would give you. But I'll come back if you work it. And then you come home and they say no, and you've got to think of another way to do it. And then you go back, and if you persist, believe me, in 1 month you will have them on the bill. Now, how many are going to follow up on that?
Why don't you bring change?
Why don't you
We're
be
gonna
part
give it
of
a try
change?
here. No, we accept the challenge.
Don't study.
So
get out and
we
do.
are going to get out and do it. Write
Get
some
out and
letters.
do.
Yes.
And let me tell you,
And go.
what you should
And
say,
lobby the
if you don't
Congress.
go on the bill, the final line, this is how I ran for office the first time. The final line, you should say, if you're not going to do what's right and fair, I'm going to run against you. Then they get religion fast.
You should know that, yes. You should know that the LGBTQ community has written their blueprint on how they achieve marriage equality in 10 years. And there's a lot there that we can learn from. All politics is local. I can't really talk about politics, I'm a judge, but all politics is local, and you heard the Congresswoman speak as to that. And so if you follow the blueprint, what they did was really smart. They identified key constituents in every elected official's district that they needed to support marriage equality. I'm talking about getting marriage equality in New York State. And so they did a very good campaign. They had PR, they had lots of people in the district go to and meet with their elected officials. And so that is a blueprint. And then 10 years later, really, the Supreme Court agreed. So they did a sea change in terms of changing public opinion, not just the law, public opinion.
Okay, we have a question in the back.
Say real quick,
Okay.
I've got to leave.
Okay.
My office is here. I'm going to say something very quickly. What they achieved is absolutely phenomenal. When I was on the city council, I introduced a bill called Domestic Partnership, the first in New York State, and they wouldn't even print it. They said it was unconstitutional. They wouldn't even print that there could be domestic partnership between two gays. I had to get in this big fight that no one can say it's unconstitutional but the Supreme Court. They finally printed it. We never passed it. Look at what the gay rights movement has achieved. And I would suggest that you should call them in to give a lesson on their blueprint. And if I'm in town, I would like to come and learn it, really.
Evan Wolfson is the person who has that.
That's great. You should get them in on how did they achieve this. They went from not even printing it, calling their movement unconstitutional, to getting into the Supreme Court and having it accepted by the country. It's an amazing, amazing achievement. And Doris, I'm so proud of you, really. You know, you get elected, you get to support people like Doris, and you get her elected. And then you can't talk to them because they're judges.
I think there was a question in the back. Go ahead.
Hi.
Hi.
Yes, I'll just stand. So first of all, yes, thank you guys, thank you all for coming, and we really appreciate your time. I really wanted to ask a question that has to do with undocumented women and women who are immigrants. All of these rights that we really, really care about seem to, like, legal and political avenues to accomplish and make sure all women have those certain rights are great avenues, but how can we use our roles, whatever they are in society, whether it's like as students right now or as politicians or as organizers, how can we use our role in society to help make sure that these rights are extending beyond a legal status and beyond a citizenship status?
I'll jump in on this. Because I feel like this is getting to something that I wanted to kind of add in a little while ago, because yes, I want anybody in this room who wants to run for office to do so. I think that's dope and amazing. I'm not, but I think it's great for those who do. What I do think we need more of are organizers, right? Organizers who have an anti-racist, intersectional analysis, and that's able to infiltrate all these different spaces that will allow us to kind of do the work that we need to. And so in reference to what's happening now with undocumented folks and being able to go really hard and to push the ways that we need to make sure that all people have all the rights that they need, is gonna take organizing power. It is, it's gonna take us, you know, being in connection with coalitions and folks who are doing amazing work at this intersection already. I can give you a plethora of organizations that are working on this from many different angles, from LGBTQ, undocumented folks, to folks who are working at it from, you know, reproductive health rights and justice angle. There are so many ways to get kind of plugged in. That's the We Belong Together coalition. They're doing a lot of great work. Mi Gente is a great organization that does a lot of work. I mean, there's so many folks who are doing it. And so it's like, how do we get folks more bring that information and make those resources more readily available for folks to know how to plug in, because that's what I feel like we need, especially in this era and this time that we're in, is we need those organizers who are ready to infiltrate the spaces that we need to be able to push that forward. So that's also like a call to action that I wanted to add in too in this time, is that, you know, you can be the doctor, lawyer, you know, teacher, whatever it is that you want to be and whatever you're coming to this school to like get your degree in, but can you use your degree to also be an organizer, right? And to really push in whatever field or sector that you're in to be able to make those changes. I hope that's helpful in some way, but it really is going to take that organizing power to do that piece of work. And the last thing I'll just add in terms of a call to action is we have to be very, very real about, like, because the other person that brought up the numbers piece, I do think that our numbers, when thinking about how we create arguments or put out analysis about numbers, our numbers also has to be intersectional, right? They have to be overlapping, and we can't just have a poll that says, what are your attitudes towards abortion? And you have these numbers that say, this percentage of people say that abortion's okay, because then your opposition just takes it and flips it back on you, right? But if we're like embedding those, or like, you know, crossing those polls and stuff with economic justice folks, with, you know, folks who are doing work on immigration, like if we're making those numbers look intersectional as well, then I think that we have stronger arguments that we can create around that. And the very last thing I will say is that in terms of a call to action is this election brought forth some really real things for us, right? When we saw the numbers and how this man got into office. Right? And we have to be real about that. And so, yes, I was very excited about the Women's March, but there was a lot of conversation that happened around that Women's March because, you know, there was a large number of white women who voted for Trump, right? Huge number of white women who voted for Trump. And that is very, very real. And that's not to be, I'm not saying that to be mean or like to start nothing, y'all, right? But what I am saying is that if we're talking about what do we need to do to get beyond this moment, is we need to start having conversations in our own families and our own circles with those folks who we know voted for him. Now, you may not have voted for him, but you know somebody in your family that did, potentially, right? And if they did, how are we having those very courageous conversations necessary to start to shift this culture so that this is not something that we see happen again? Because what, you know, I keep hearing in our activist spaces that we're resilient and we're great and we're amazing, and we are. And we just like, we got to organize more, we got to do more. Yes, we do. But I'm in a place of privilege, even as the black woman that I am in the South, right, that has a lot of oppression wrapped around it. But I'm still in a place of privilege because, you know, I have a job. You know, I get to go and do this work every single day. I'm paid to be the activist and organizer that I am. But the folks who are the most marginalized, the most impacted, they're going to have to not just figure out what work they're going to do to get through the next 4 years. They're going to have to figure out how to survive the next 4 years. And so all of that is, so when I think about holding that, it's so important for these courageous conversations to happen, y'all. And we got to find ways to really attack the root cause of all of this, which is attacking the system of white supremacy that is real in this country, and it impacts every facet of our lives. So we got to get on it, and we got to be willing to have those courageous conversations.
And thank you so much, Rhonda. That was amazing. And in addition to the Women's March, we saw people out protesting at airports.
Absolutely.
You know, we've seen more protests, I think, in the last, 3-4 months than we saw in all of the last few years combined, probably in the U.S., if not longer. I don't know that statistic. But so I think the point is we can organize. Right? We can get out there. We can be active. We can do it in an effective way. Maybe we need to figure out the most effective way, right? The best coalition of groups. Focus on 1 or 2 issues. And I don't know what your strategies are for that, but I think we definitely can do it. I think organization is the key.
Just wanted to add something. So one thing that we've all been feeling really good about at the UN is our new Secretary General, Antonio Guterres. He used to run the refugee agency, and before that, he was the Prime Minister of Portugal. And when he took up his job on January 1st, he said that gender equality and women's empowerment were going to be one of his priorities. And he said, just watch. And then a few days later, his deputy, his senior policy advisor, and his chief of staff were named, and they were all women. and women from Nigeria, Brazil, and Korea, who are all incredibly well thought of, powerful women. And he spoke at a World Humanitarian Summit consultation last year, and we had a panel, and there were questions from the audience that were gathered electronically, which was fascinating because then people asked these questions that UN officials, UN staff would never ask if they had to raise their hands to ask them. And one question was around women's rights, and everyone else on the panel gave really terrible answers. And he said, and he was still head of the refugee agency, he said, I don't understand why we are denying, I think he even used the word patriarchy, which is not used every day at the UN. He said, why are we denying this and why are we being defensive about it? We live in a patriarchal society. Our job is to fix this. Like, stop with the excuses, let's just go on and fix this. And so we have some good leadership at the UN, but that leadership needs to be held accountable, which is what I think you're speaking of, what the Congresswoman was speaking of. So in addition to, calling your Congress people to ask about the ERA, you can also ask questions on this, and you can also ask questions on what we're doing at the UN. And not everyone in this room may be a US citizen, you may be citizens of other countries, and you can call your representatives and say, are we supporting UN agencies financially? What if your country is in the Security Council, what's going on? You can ask, the State Department works for all of you as well. And so what are they doing day in and day out? And the State Department has, of course, historically been a very strong champion of these issues. And I also actually have to put into context that women in the United States don't really necessarily enjoy as good of rights as women in other countries do. So I think many Americans and many American women just assume that the situation here is better than it is in any other country, where that's not correct. In terms of representation of justices in the legislature, in the executive branch, it's higher in many, many countries. Most of them do it by quotas, but it still gets qualified women there. It's not unqualified women that come through those systems, it's very qualified women. And that's how you get there. That's how you create this norm of women being in these positions. So just to remind you that it's not just your elected representatives, but it's also what the government agencies are doing that that you can hold them accountable for these things, and you can continue to ask these questions. And also, it's not just you as lonely individuals, it's you as part of these organizations. You could join both of these organizations. You can join organizations similar to them that exist in your communities, in New York State, and it's the power of the group, which you were also speaking of, that when the LGBT community came together and said, we are going to do this, and how do we do this, that they got it done. So I think people get frustrated when they think, I can't do anything, but it's when we come together that we begin to accomplish these things.
Question.
I wanted to underscore one of the things that Monica said, but it also, I think, has run through the other comments as well, and that is the importance of a multidisciplinary approach to these issues. And I think health is a really powerful one. I think there's also a danger on the health side that if we get focused on abortion, that is such a toxic issue that it overwhelms support for a whole range of things. And I think the hook of health through many lenses is really powerful. No one's against health, even for women. So it's a very powerful place to promote support of women. And I think that is encouraging to me when I think of the voice and the power that doctors have. Oftentimes they forget how powerful those voices are. People listen on all kinds of things because they're doctors. And now that we have 50% of our medical school classes are women, that's really powerful for us. And I really hope that we encourage professionals in many fields, certainly in politics, but even in healthcare, to be political and to speak from the power of what you have.
I'd like to comment on that as well. Yeah. I want to couple your comment with the woman, I think she left, which she mentioned sometimes in terms of economics. and having in a previous life done lobbying on not-for-profit issues. Sometimes you cannot convince them unless you talk about economics. So in terms of health, if you talk about denying healthcare at a fundamental level and how much will cost because people go to emergency rooms and how much that will cost the government, sometimes that can make a better point than just saying, oh, these women are going to be affected, feel sorry for them, give us some money. So if we turn our arguments into economic arguments, we sometimes can have better sway.
The work that, I just want to say one thing.
Yeah.
Real quick, because I just had to say something about health and about physicians, actually specifically, since I'm physician representation here on the panel. So of the 250 plus departments of OBGYN in the United States, there are potentially 5 to 6 chairs of OBGYN that are women, okay? I don't know what the deanships look like for the medical school. I can't give you that number. It's probably a little larger. But we're talking about OBGYN departments that take care of women are largely, vastly run by men. Okay, so that's one. 2, there's an American College of Obstetrics and Gynecology, of which 99% of practicing OBGYNs belong to. I had the privilege of actually being on the national committee for that society for many years. I was one of, in the committee is 25 people. You have to be basically, I don't want to use the word grandfathered, but you have to kind of have been in positions of, of leadership throughout your career. And then when you sort of are closer to the end of your career, you can be president or vice president, et cetera. I was one of 3 women on the committee of 25. Every time I spoke about, global issues, as the American college, we should be doing more globally. Those weren't necessarily they were considered very political issues. So I think that there is a lot that they do, and I know family planning and contraception and abortion has in recent years been much more supported in ACOG. But I think that this issue of equality between the sexes permeates every facet of professional life, of work life, and medicine is no different. Medicine is the oldest, one of the oldest, not the oldest, but one of the oldest of all professions. So it's very patriarchal.
I do a lot of work in both women's health and infant and child health. And last year, we had a policy summit in Washington, and one of our speakers was from the World Bank. And he got the most coverage, the most tweets, the most press afterward because he was a new voice speaking out for women's health.
I think that's right, but I wish it was true that health, everybody loves health, even women's health, because in the countries where I work, it just isn't true. I mean, I think Tara started off with the maternal mortality statistics in countries around the world. I mean, these are preventable deaths that people don't invest in. And so I do think that depending on where you are and the value you place, even in this country, women and, a certain type of women, a certain color of woman, that matters even in the medical profession. And you can talk about women dying all you want, and it still doesn't receive some of the same care that you might receive in other sectors. So I wish it was true, but unfortunately it's not. And this gender dynamic is something we do have to handle writ large. And then the hope is it will permeate into the healthcare field. But women's health I talked about the global gag rule. We have sent in so much data to this administration because we're in our 3rd leg of the global gag rule. This is not the first time. And we have shown statistically how harmful it is to women's health around the world. And that does not matter. It does not matter. So.
Monica, because I stopped her.
Oh, no, it's totally fine. Here, take this. Oh, cool. Yeah, I just want to add a piece to that. I really appreciate your question, and I appreciate you for lifting it up. But there was something in what you said that was like a complete trigger for me. I just had to own that. And abortions are not, toxic, right? And I'm not saying that you're saying that. But what I'm saying is that we need doctors to be able to help us shift that narrative that abortions are not toxic, right? And it has become like this moral issue. It's become this wedge issue. It becomes everything that it's not. It is a part of our reproductive health care. Women have always controlled their own fertility. We've always had the abortions that we needed to have, going all the way back to the beginning of time, right? So we need more doctors who are able to articulate that from a medical perspective and to help us reduce this stigma around abortion and including it in healthcare in a way where it doesn't have to be something that's separate, but it doesn't have to be something that is excluded because it's going to bring up such tension, that it isn't, it's a part of our healthcare, point blank, period. And there are great groups like Medical Students for Choice. There's, the Nursing Students for Choice is another, right? So there are different coalitions and things that have been built to help, bring up, medical students and folks who will be going into, their practice with these, with this analysis and to be able to like really help us shift this. But we need more doctors doing that. You know what I'm saying? And if we don't have doctors on our side that are willing to like take that very radical stance with us in some instances, we know that it can be, then it's gonna continue to be like this wedge issue, and it's gonna continue to kind of just be all stigmatized, and it doesn't need to be. It's just something that we gotta have. It's there, all right, period. Like it baffles me that we keep having to come back to this, but it's because we need more voices, including medical doctors, to be able to help us articulate it in a way that helps people understand that it's a part of our overall health care. That's our human right to have.
All right, well, it's 6 o'clock now, and I hate to say goodbye because this is such a fantastic panel. But I would like to take the opportunity to thank all of our fantastic panelists. This was really amazing.